I'm heading from Brooklyn to uptown Manhattan for what used to be a routine doctor's appointment.
The first effective drug to treat the biggest pandemic in more than a century.
They're China-centric, to put it nicer, but they're a puppet of China.
It's Friday, May 22nd, 2020.
And here's QuickTake's wrap of the pandemic this week.
You may have noticed in your neighborhood and across the U.S., many people are opting out of a routine trip to the doctor's office during this pandemic. But as my colleague Angelo shows us, that's not always an option for people with chronic conditions.
I'm heading from Brooklyn to uptown Manhattan for what used to be a routine doctor's appointment. I go every 8 weeks to get an infusion of a medicine called Remicade. It's for Crohn's disease. So I haven't been since before the city locked down. So I have no idea what to expect. On a normal day, where I come through here every day to go to work, it's packed with commuters, completely full, and now it's basically empty. Made it to Manhattan. So now I'm on the lovely Upper East Side of Manhattan, which you may be familiar with from the hit television show Gossip Girl.
Hey, Upper East Siders, Gossip Girl here.
I'm sure you'll notice that my mask is not great. It's actually a balaclava. It's meant for keep you warm when you're running or riding a bike. And I'm wearing work gloves. I had a surgical mask and I had rubber gloves, but I basically wore them all out buying groceries over the past couple weeks.
Just checking temperature right here.
They gave me a new mask, which is great. And I'm in a private suite. Normally, these infusions take place in a room with maybe like 3 to 5 people in them, usually older people who are getting hooked up to an IV like myself. So it's nice that we're in our own spaces here. My infusion is for a medicine for Crohn's disease, which is an autoimmune disease. For some people, it's pretty mild, but myself, I've actually had to have 3 pieces of my intestine removed in my lifetime. The medicine that I take makes me immunocompromised. Basically, I just sit here for 2 hours while this medicine drips into my arm. It's not that bad. I'm gonna play some Animal Crossing. So I'm good for another 8 weeks. Now that I've got my mask and some fresh gloves, I feel prepared. On the way up here, the subway was a little crowded. Not everyone even had masks and gloves, so I think I'll take my chances in a car. So I wanted to check in with my gastroenterologist, who only sees patients with chronic conditions.
Mr. Spagnuolo, how are you?
Dr. Spalmanoff, I'm well, thank you for asking. Have you guys had patients express hesitance about coming in?
People are afraid to go to hospitals and afraid to even just resume routine care. Just like you had to get used to being at home and wearing a mask, you're going to have to get used to coming outside and doing all the things that you still need to get done because that's still part of life.
Was there one maybe key insight from the notes from national institutions about IBD patients?
The main question in everybody's mind is that are people who are on immune suppressing medications in for a very rough ride if they get the coronavirus infection? Although there was this fear of it, it turns out that in fact, they were not having worse outcomes based on this. So there was an early theory that, that these drugs, while they may increase the risk of getting a viral infection, that they might decrease the risk of a severe outcome from the viral infection by interrupting the cytokine storm that's been described. So in terms of having worse outcomes than the general population, it has not been seen yet.
During this global pandemic, the world, for the most part, has looked to the World Health Organization for guidance. Instead, it's found controversy.
Right now they're They're literally a pipe organ for China. That's the way I view it.
Can this crisis force the world to say we really do need a well-functioning and truly neutral World Health body that will not be beholden to various financial interests or political interests?
This is the story of how the WHO tried to please the world and ended up losing its biggest backer.
Antiviral drug remdesivir has been giving the world some hope in the fight against COVID-19. Here's how the drug maker Gilead Sciences has been preparing for this moment.
On New Year's Eve of 2019, a scientist at Gilead Sciences received a disturbing email from a top virologist. There are rare cases of a mysterious pneumonia going around in Wuhan, China. Nobody knew what was causing it. Watch this one, the virologist warned. It might be new coronavirus. Remdesivir was one of the few experimental medicines back in January that had already shown promise against a wide variety of coronaviruses. So when Chinese scientists confirmed that the mysterious pneumonia was indeed caused by a never-before-seen coronavirus a couple weeks later, Gilead scientists knew right away that their drug was going to be a top candidate to treat it. There haven't been many examples of foresight and preparedness in this pandemic, but the story of Gilead's remdesivir is one of them.
That COVID-19 can be characterized as a pandemic.
At a time before the World Health Organization confirmed there was human-to-human spread, and long before anyone knew it was a pandemic, Gilead started forming a task force, studying how to test remdesivir and, if it worked, how to mass produce it quickly. The months-long process employs 70 raw materials, reagents, and catalysts, and they are mostly processed in 25 largely sequential steps. But thanks to the company's earlier work with remdesivir of Ebola, it already had a small supply of the drug on hand, and that allowed clinical trials to begin almost right away in China and Europe and elsewhere. However, filling enough vials to treat potentially millions of patients in the pandemic would require a lot more of the drug. So back in January, Gilead ordered enough of necessary key ingredients to produce more than 1 million patient courses by the end of 2020. That early decision helped pave the way for what appears to be the first effective drug to treat the biggest pandemic in more than a century.
Remdesivir has a clear-cut, significant, positive effect in diminishing the time to recover.
Gilead has reported that one of its coronavirus drugs is working.
It's one of the most watched therapies on being able to potentially treat COVID-19.
But to be clear, it's not a miracle drug. In severe cases of COVID-19, the medicine appears to speed up recovery by about 4 days, according to preliminary results of a 1,000-patient trial. The U.S. Food and Drug Administration didn't allow Gilead to claim that the drug is safe and effective for COVID-19. It only said there's a reasonable probability that the drug may help. Gilead plans to donate the first 1.5 million vials, enough for roughly the first 200,000 patients, and says that by fall, a much larger supply should start to become available. The question is, can Gilead and its partners make enough of the drug for the whole world?
COVID-19 vaccine development and deployment in China, when available, will be made a global public good.
So more and more questions are coming up about social distancing, especially as states begin to open up and the weather gets nicer. Bloomberg News health reporter Kristen Brown, like many of us, has been one of those people asking some of the questions about social distancing.
This has been hard, right? I live in the Bay Area. We were the first place in the country to go on lockdown. A few weeks in, like everybody, you start to get restless. I missed my best friend. I missed having a drink with a friend at a bar. I started asking questions about what is actually risky behavior and what is not.
And you were able to speak to some public health experts who said that the messaging needs to change. What did they tell you?
I think we're really at this inflection point. There was a moment where public health experts agree it was very important for us to shelter in place. While the curve is flattening, the risk hasn't gone away. We don't have a vaccine. We don't have a way to protect people from getting infected again. Experts are calling for us to re-examine what we have learned about the virus and to then apply that to social distancing policies so that we can still have good health and hygiene practices, but also meet your best friend in the park for a beer from 6 feet away. New York City, for example, is really ahead of the game. They just put out guidelines for how to safely have sex during COVID-19. They present it not as a binary risk. There is a spectrum of risk. The messaging going forward is going to be that we really need to look at the science, look at what's going on with the virus, and be nimble.
What are some of the things that they told you about COVID-19 that people can maybe use to assess their own risky behavior?
We know, for example, that the virus is much less likely to transmit in outdoor areas. Having a picnic outdoors with your friends, as long as you're not hugging and sharing a beer, is a lot safer than having people over for dinner. Some public health experts are encouraging people to go outdoors, and some cities have done that. For example, Oakland, where I live, we have blocked off 10% of the streets now to car traffic so that people can get out, enjoy the beautiful California sunshine.
What are the things that are still high risk?
I think any behavior in which there's high contact. So shaking hands, hugging, probably don't invite your friends over to watch a movie on your couch until the rate of transmission has slowed or until there's a vaccine. These really are risky behaviors, but you can still socialize outdoors with your friends at a safe distance.
In Ukraine, an all-female pink taxi service is saving lives by delivering dialysis to patients during the lockdown. Take a look.
Hi everyone, I'm Sarah Ponsick and I am a reporter with Bloomberg News. Over the past couple of weeks, some famous investors have made some headlines with their comments about the stock market. And quick spoiler alert, they have not been the most optimistic. Take Warren Buffett, for example, known as the Oracle of Omaha. Well, at his company's annual meeting in the beginning of May, we found out that during the sell-off, he was actually raising his cash pile rather than deploying it. Well, typically during a sell-off, the idea is that at the lows, there are great deals. You can find stocks at such great value that is when you want to put money to work. So the saying we all know is actions speak louder than words. So if Warren Buffett wasn't buying stocks then, why should other people have been? And he's not alone. Take investing great Stan Druckenmiller, for example. Over the past couple of weeks, he came out and he said that the prospects for a V-shaped recovery in the economy are nothing but a quote-unquote fantasy. A V-shaped recovery is exactly what it sounds like. Say you were to chart GDP, gross domestic product, for example. If it looks like a V, that means you have fast down and you also have fast on the way up. So what that looks like on a chart is the letter of a V. Well, he said it's a fantasy, and he also said that the risk reward for stocks right now that he sees is the worst of his lifetime. So quite the proclamation, and they're not alone. We've heard from others coming out too, but meanwhile, stocks, the market, has remained resilient. But to their point, we have started to see some fragility in the markets. Take what happened with Moderna, for example. This past week on Monday, there were some great reports about one of its vaccine trials for the coronavirus, and we saw the S&P 500 jump over 3%. Well, the next day, we had some reports that were coming out that were a bit more skeptical, and we just saw it reverse. We saw stocks reverse as they were going into the close of markets at 4 p.m. and they ended the day down. So volatility is creeping back into markets. Daily swings are now widening out. Certainly, it's all keeping us on our toes.
Governments all over the world are cautiously reopening businesses and public spaces, but experts warn the coronavirus pandemic could continue in waves lasting beyond the year 2022.
It's the thought on everyone's mind right now.
Florida is ready to take its first steps toward reopening.
Texas is open for business.
South Carolina, Oklahoma, and Alaska also slowly opening for business.
When will we actually be ready to reopen? I hit up my colleague and friend John Lauerman to ask more.
What's the big number? How long is this potentially going to last according to the experts that you've spoken with?
Yeah, the idea is that the pandemic might last for 2 years, which is kind of surprising considering that people are already talking about reopening. We will need to go back to a very strict regimen of lockdown unless we have a vaccine. If there's a vaccine, then all bets are off. Now we've got all this new vaccine technology, like the mRNA technology from Moderna, that enables us to develop vaccines extremely quickly in a matter of months. Whether that's going to be enough to vaccinate the entire world, that's anybody's guess.
And will we experience any normalcy in those 2 years, or will it be locked down the entire time?
If people continue to, catch this disease and die very quickly, you have to do something, right? You can't ignore that. And so the measures that we have in the absence of a vaccine are social distancing measures.
My concern that if some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks.
Dr. Fauci said rather famously, we don't make the timeline. The virus makes the timeline, right? But in many ways, the virus does not make the timeline. The lawmakers and politicians make the timeline, and they make the decisions. I think a lot of it is based on what they're sensing from the population. A lot of it is based on the economy, things that can't be predicted. If your hospitals are incapacitated by people needing care for COVID, then you have to make some decisions based on that as well. On the other hand, if your hospitals aren't full, and a lot of hospitals aren't, then they may feel empowered to open.
During this global pandemic, the World
Health Organization launches a collaborative project to find a vaccine and treatments.
The World Health Organization warning young people they're not invincible.
The World Health Organization officially announced that this is a global pandemic.
Instead, it's found controversy.
Where President Trump does find fault in handling the pandemic is the World Health Organization.
Right now they're literally a pipe organ for China. That's the way I view it.
He accused the body of being too trusting of China's assertions that it had the virus under control.
They not only need to answer to the needs of over 100 member states, but the whims and politics of the countries and organizations that donate the lion's share of their budget. This is the story of how the WHO tried to please the world and ended up losing its biggest backer. The World Health Organization was founded in 1948 by the also newly formed United Nations.
Czechoslovakia, Yugoslavia, Denmark, Greece, Poland, Hungary, and many other nations have benefited from WHO.
Headquartered in Geneva, they were tasked to mandate and coordinate health policy.
Initial vision for the World Health Organization was not only to make it an important agency focusing on health issues and disease outbreaks, but to try to create a form of international cooperation and collaboration that would bind the nations together.
And in the coming decades, the WHO has taken on a dizzying amount of missions, from world-altering ones like the eradication of smallpox and the identification of HIV, to awareness campaigns like safe driving, suicide prevention, and anti-smoking PSAs.
Well, there are several main roles. So one is to what they call its normative role, which means it sets standards for medical matters throughout the world. And it has an important role in providing technical support to low and middle income countries.
In order to tackle all of those initiatives, the WHO has become an incredibly complex organization. There are 6 regional offices around the world: in Congo, Denmark, America, India, Egypt, and the Philippines, all of which report to the headquarters in Geneva.
Each of which has its own mode of functioning, bureaucratic staff, and the like.
The balance of authority between the regional offices and the headquarters in Geneva has always been slightly problematic to get them all reading from the same page when they have different regional constituencies.
And within those regional constituencies are 150 country offices. In order to run all of those offices requires a great deal of money, originally in the form of assessed contributions, or dues, by the member states.
Assessments were determined by the overall GDP or economic strength of that particular country and its population. There was some formula worked out.
And that formula worked for a while. Member states paid their dues, the WHO provided guidance for health issues around the world. But over the last 3 decades, that amount of money declined and is now only about 20% of its overall budget. Today, the WHO is mostly funded by voluntary contributions, with the United States being by far the highest paying contributor, followed by the organization started by this guy.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
And when and where the WHO gets its money from influences so much about what it can do.
And the Bill and Melinda Gates Foundation can say, through our extra budgetary funding, we're like so much invested in polio. No one can tell us not to do that. And that has made the WHO a very unbalanced and complicated organization.
That unbalanced and complicated bureaucracy has consistently been one of the World Health Organization's biggest criticisms. But they've also been criticized for how they've reacted to the past two major epidemics before COVID-19.
We've now seen another outbreak of SARS, potentially we've seen a cluster and transmission of the SARS virus.
In 2003 was SARS. The WHO was criticized for overreacting to the disease, which only had 774 known deaths, but ended up costing East Asian countries over $20 billion in lost GDP.
Hotels, tour agencies and travel companies are reported to have suffered huge losses during the outbreak.
That led to an underreaction in the response to the Ebola epidemic in West Africa in 2014.
The big decision before them, whether to label this worst ever Ebola outbreak a, quote, public health emergency of international concern.
It didn't get a grip on the situation. It delayed in calling this public health emergency of international concern.
The head of the World Health Organization, Margaret Chan, she has experience dealing with outbreaks like bird flu, like SARS. Shouldn't she have been handling this better?
And so it was a general mess, which led to many investigations afterwards about the WHO's very slow and inefficient and inadequate response.
So with the overreaction to SARS and underreaction to Ebola, COVID-19 was a chance for the WHO to finally get things right. And initially, everyone seemed happy with their performance.
COVID-19 is a real threat. It is a real threat to everyone on the planet.
It took the WHO 1 month to declare COVID-19 an international health emergency. Compare that to the 4 months it took them to call Ebola an international health emergency. And Trump, who originally praised China and the WHO's response to the pandemic.
So far, I think China's been trying to be, or at least they seem to be trying to be, somewhat transparent with us.
He later turned on a dime, blaming not only China for the pandemic, but the WHO as well.
The WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China for its so-called transparency. I don't think so.
This was partially a response to the WHO Director General Tedros Adhanom Ghebreyesus' constant praise of China during the pandemic.
I will praise China again and again because its actions actually helped in reducing the spread of coronavirus to other countries.
China, as well as critics of Trump's administration, say Trump shifted the blame for domestic political reasons to divert attention from his catastrophic failure to address the crisis in America, whether it be from initially downplaying the virus.
In this big, vast land of ours, this great country of ours, we have 240 cases. Most of those people are going to be fine.
To touting unproven treatments.
A drug called hydroxychloroquine. And it's shown very encouraging, very encouraging early results. I think it's going to be great.
All while the death rate in America surpassed that of the rest of the world. And even though there are accusations that China has not been transparent about their numbers of COVID-19, Tedros and the WHO were presented with an impossible decision.
This is international health diplomacy. The WHO has no power of enforcement. They cannot dispatch a team against a country's wishes. They're dependent on data coming out of that country with a presumption that countries will cooperate.
In no situation could the WHO please both the US and China, and that resulted in Trump taking punitive action.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess mismanaging and covering up the spread of the coronavirus.
And remember that chart for who funds the WHO? It's not just a huge loss for the organization, but for poorer countries around the globe.
Every one of the essential functions of the WHO would be immediately challenged and threatened, if not stopped.
And while America has the CDC to create their own guidelines and best practices,
countries in Africa and other parts of the world don't have those resources and are desperately dependent upon the WHO to provide equipment, information, interventions, And now those will be seriously challenged, if not stopped completely.
So where does this leave the World Health Organization right now? Apparently, it's not up to them, but us.
Reminded of a quote by Larry Gostin, who was one of the international health experts who was very important in the WHO. He has said, "The world has gotten the WHO that it deserves. The world has created this organization with all its faults, flaws, inconsistencies, and inefficiencies. Can the world wake up? Can this crisis force the world to say we really do need a well-functioning and truly neutral World Health body that will not be beholden to various financial interests or political interests? And out of crisis can come not only disaster, but hope and a new beginning. Will the world let it?"
All right, that's the show for this week. Thanks for watching. But remember, you can find all of your coronavirus news from QuickTake 24/7 on Twitter, Instagram, Facebook, and of course, YouTube.
And for a daily recap of the day's top stories, subscribe to our newsletter. Thanks for watching. We'll see you next week.